Assertiveness, Part 2. Although the term manipulation has a negative connotation in our society, manipulation in itself is not necessarily a maladaptive behavior, and sometimes manipulation is taught and accepted in some cultures. An assertive approach will be met with resistance and resentment at times. You have the seducer, who initiates a relationship with others and then will seek favors or privileges, and then might become angry when those privileges or favors are not forthcoming. Passive aggressive will focus on another person's weaknesses and then exploit that knowledge. An example would be ripping someone in front of a witness, such as a patient or peers. Divide and conquer will sow seeds of distrust by telling half-truths and spreading rumors or gossip or innuendos. In other words, you're trying to separate two people by not being really honest. Contributing factors to aggressiveness and work-related issues would be personal factors such as communication, workplace practices such as staff shortages, environmental factors, which can be the location of the care that's provided, risk diagnosis. It's necessary to protect yourselves, whether the threat is coming from a patient's family, a coworker, or potentially just somebody that has walked in the doors. You need to make sure that you have an escape route planned. Never block a door in an aggressive situation. Make sure that you maintain an open stance. In other words, don't cross your arms or your legs. That closes your stance. Keep at least 5 to 7 feet between you and the potentially violent person. Remain calm and never turn your back on a potentially violent person. Nurses should advocate for a safer workplace. The prevention of workplace violence is an important safety issue in hospitals and other healthcare facilities. The workplace is any location where an employee performs a work-related activity. There's 4 categories of workplace violence: employee, domestic, property, and commercial. Contributing factors to workplace violence again include personal, workplace, and environmental. In the United States, there's a general duty clause in the Occupational Safety and Health Act, or OSHA, that includes recognized threats of violence. So there's 3 different stages of workplace violence. The early signs will be unusual behavioral change, lack of cooperation with nursing supervisors, cursing and other hostile forms of communication, short fuse and frequent arguments, spreading gossip or rumors to harm others deliberately, uninvited sexual remarks, hostile responses to other nurses, patients, or family members, sleep disturbances mentioned at work, and increased irritability and anxiety. The next stage includes conversation that is focused on "poor me," the victim, notes that have threats or violent or sexual content, verbalization that includes plans or a desire to harm someone, stealing workplace property, decreased interest in work and workplace assignments, increased arguments, and increased physical accidents or injuries. As anger intensifies, the last stage, behaviors are directed towards oneself that might include depression or suicidal threats, and behaviors that are directed towards others that might include physical fighting, property destruction, or the use of a weapon to harm others. So what can you do? Well, you need to recognize signs of potential employee violence. Know your company's policies and prevention guidelines. Participate in the training and refresher courses that are offered by the healthcare agency. Take advantage of programs that are offered by your police department or other agencies. Advocate assertively for implementing prevention policies. Be alert to warning signs. Think about what you can do. Unfortunately, nurses work long, hard shifts, and often they arrive in the dark or they leave in the dark. And in these instances, what would be a safe way to make it to your vehicle, especially in a busy city such as Wichita or Kansas City, etc., in the dark? Be prepared before workplace violence becomes an issue. Remember that your focus is on gentle self-defense, not offense. Take all threats seriously and report all threats to management. Hospitals and other healthcare settings do employ security personnel. Call them if you have security concerns or issues. Learn how to reach security personnel at all times. And use your own instincts and assessment skills. Never be reluctant to ask for help. More than 50% of female nurses and a third of male nurses believe that they have been sexually harassed on the job. Claims of harassment should be taken seriously and should be investigated. Some behavior might not specifically violate company policy, even if it does upset the complaining party. For example, one employee shows more than an average interest in another person's life. Might this be perceived as harassment? While some situations might not require investigation, they do require resolution that both parties can understand. Addressing complaints prevents further misunderstandings from turning into larger conflicts and indicates that the organization is committed to protecting its workplace from harassment. So what do you do if you encounter sexual harassment? Make sure that when you report, the recipient of unwanted behavior should inform the harasser directly that the conduct is unwelcome and must stop. You've got to be assertive. The recipient should use any workplace complaint mechanism or grievance system available. And remember that prevention is the best tool to eliminate sexual harassment in the workplace. Lateral violence occurs between colleagues. It can be very overt, out in the open, or hidden. It can include physical, verbal, and emotional. Bullying is an act that is perpetrated by one in a higher level of authority when we're talking about violence in the workplace. Vertical violence is violence that occurs between people of unequal power, where lateral violence is between your peer. Insidious aggression is a lack of action on the part of the nurse, giving approval and permission for the perpetrator to continue the behavior. So if you do not address an issue, then basically you're saying that it is okay for this behavior to continue. As a nurse, you have the responsibility to act assertively with the cooperation of other nurses to advocate for a safe workplace.